Findings from a new study suggest people who have been infected by the Omicron variant have more immunity against the deadlier Delta variant. It's good news as it supports the predictions that the fourth wave of COVID-19 would be less fatal. So Dr. Alex Sigal is a member of the African Health Research Institute and has been involved in this study. Professor, thank you very much for your time. So you studied about 15 people infected by Omicron and they unexpectedly developed antibodies against the virus. Can you just tell us exactly what does it mean when we say the study suggests Omicron enhances neutralizing immunity against Delta? What are those findings exactly?
Well, I mean, we looked at people's immunity, their antibodies in the blood after infection with Omicron. And not surprisingly, they get immunity to Omicron. But what surprised us and kind of made us pretty happy was that they also had more immunity to the Delta variant. And as we know from our experience in South Africa, the Delta variant is more pathogenic. It causes more severe disease. So, I mean, Omicron, while it's not completely benign, it might be the best of the worst. And what this data might mean is that Omicron will push the more pathogenic Delta out.
But then the sample, and just correct us here, is of 15 people. So if we're looking at the sample size of 15 people, how much faith can we actually have in the study in terms of an equitable or fair representation of the population at large?
You can have a lot of faith. It's more people now. We just released those results early. But in general, people have similar responses in terms of the general response. They may differ in the levels of immunity, but the trends are similar between people because people are not that different from each other. So I think these results are pretty solid.
I want us to labor on the point right now of the sample size and as well. Was it also taken against the different ethnic groups, racial groups, age groups and the like? Were all those considered when it came to being able to understand and unpack exactly what this Omicron variant presents in terms of immunity?
So, I mean, this was mostly done in the predominant population in South Africa of Black South Africans. And I have to say, our team of nurses and people in the lab were absolutely terrific because there's not many people now left standing. A lot are home isolating because they're infected themselves. So this was, you know, this was a tough study to do. It was really a wartime study, but we felt this is important enough, you know, to actually do this kind of thing in the middle of the holidays.
Yeah, but then can we conclude anything about how people are likely to manage other variants in the future? I mean, does that give us an indication of what we'll be dealing with in the not-so-distant future?
Well, what we're hoping, and of course we don't know yet, but we're hoping this is a trend so that less pathogenic or less variants that cause less severe disease will start pushing out the variants with more severe disease. And while the infection is not going to go away, we'll be able to live with the pandemic easier. So we'll be able to live with the virus easier. It'll cause less disruption in our lives.
So if we're understanding correctly, in the not-so-distant future, we may see the different variants present themselves as almost flu, so to say. So we manage it and we deal with it as if you've got a cold, as opposed to you now have got COVID-19. Would that be safe to assume?
Well, this is maybe the most optimistic scenario, but maybe COVID will never be a cold, but it may not be quite as bad as what we started out with. So things are getting better.
Does vaccinating play any particular role in the study as well as what has been gathered here? Does it speak to those that have been vaccinated then that would see that this Omicron variant presenting such immunity? And what does it say about vaccinating?
Well, in our study, and now the numbers are larger, vaccination definitely helps. So if you're vaccinated and you're then have an infection with Omicron, you get a faster and a better enhancement of your immunity against Delta. So it's another reason for vaccinating. I think we're going to be vaccinating for a long time to come, but it's a great tool in our arsenal.
Yeah. So, Prof, before I let you go, does that mean that, let's say that if 65% or 70% of South Africans are actually vaccinated, with the spur up of different variants that we may see of this COVID-19 pandemic, will we then find ourselves being able to manage the virus much more easier, and the virus not being as deadly as it were had a significant portion of us not have been vaccinated? So once we get vaccinated, does that mean we can just relief and relax a little bit more?
I don't know if we can ever relax completely, but the combination of vaccination and perhaps these variants which cause less severe disease but are very transmissible, so they're pushing the other guys out, that's going to make things easier for us.
We'll leave it there. Professor Alex Sigal, thank you very much for your time as a member of the African Health Research Institute, just giving us the latest there. You heard it there. It is the Omicron variant that enhances neutralizing immunity against Delta.